IgA vasculitis is most common in children. It's also known as Henoch-Schoenlein Purpura. It's characterized by the deposition of an antibody called immunoglobulin A along the walls of small blood vessels. This leads to inflammation and can cause damage to these blood vessels. There can also be the formation of granulomas, which are clusters of immune cells. These lesions can result in narrowing and scarring within the blood vessels, which leads to the problems associated. It can affect various parts of the body. The symptoms can be quite mild, all the way through to much more severe presentations. In some cases, IgA vasculitis can lead to long-term complications. Thankfully though, with this condition, fatalities are quite rare. It's much more common in children, typically occurring between the ages of 3 years old and 10 years old, and it seems more common in boys than girls. It is also sometimes seen in young adults though. It affects roughly 20 per 100,000 children in the UK annually. In some Asian countries, that incidence is slightly higher. Symptoms include presenting with a distinctive purpuric rash. That is a rash that doesn't blanch when pressure is applied to it. Joint pain, abdominal discomfort, and in some cases kidney problems can also be part of the presentation. This rash is quite characteristic and usually appears in specific areas, especially on the lower legs and around the buttocks. It is dark purple to black, and as we've heard, a purpuric rash does not fade when pressed. The condition can last from a few weeks through to several months, but in most cases it does resolve without lasting issues. A complete understanding of IgA vasculitis is not yet clear, but we do think this is an event triggered by an infection. The body produces IgA, and these complex together, which can clog up the blood vessels, leading to the inflammation and damage. The variety of symptoms can be fairly wide. Most commonly there will be the presence of a rash, joint pain. If the gut is involved, you may get gastrointestinal problems. This could range from pain through to blood coming out in the stool or poo, and sometimes kidney damage. Most people do fully recover, but some people do experience some long-term kidney complications, particularly a condition called glomerulonephritis, which is inflammation of the filtration system in the kidneys. In common with other medical conditions, the first step in obtaining a diagnosis is obtaining a full medical history, or the story of the symptoms. This includes a story of rashes, joint pains, abdominal pains, and diarrhea, sometimes with blood present. The physical examination will then focus especially on looking for this characteristic skin rash, pain in the abdomen, and joint pain. Blood tests will look for a full blood count and will check the levels of IgA. IgA, along with the characteristic rash, are usually the key features in making this diagnosis. Commonly, it is presented after an infection, several weeks after the infection may have cleared. Imaging tests like an ultrasound or CT are sometimes performed to look at internal damage, and a biopsy of the rash can be quite helpful in confirming the diagnosis. Capturing this diagnosis early is helpful to keep monitoring and preventing long-term complications, particularly involving the kidneys or the gut. Once a diagnosis of IgA vasculitis has been made, managing symptoms and preventing further complications is the key priority. In milder cases, non-steroidal anti-inflammatory drugs or NSAIDs may be used first line to reduce pain and swelling. If this is not sufficient, corticosteroids or steroids may be given for a short period. In some of the more severe cases, immunosuppressive medications are needed to help suppress this. It's like there'll be some intervention from specialists. This could be a pediatric rheumatologist or a pediatric nephrologist with regards to the kidney. Even once IgA vasculitis has cleared, in many cases, long-term follow-up through childhood is helpful to ensure any potential complications of the kidney are picked up early and are managed appropriately. If no concerns are noted throughout childhood, this may not necessarily be required into adult life. In summary, IgA vasculitis is a condition that largely affects children, but some young adults can be affected, and the symptoms are often self-limiting and mild, mainly involving a skin rash and some pain. But some kidney complications have been noted and is the main concern which needs to be monitored for. A timely diagnosis and a tailored approach are essential in managing the conditions and helping to keep an eye out for any potential long-term consequences and addressing these as soon as they may arise.